Trichotillomania, also referred to as hair pulling disorder, is a mental disorder classified under obsessive compulsive and related disorder and involves recurrent, irresistible urges to pull hair from the scalp, eyebrows, eyelids, and other areas of the body despite repeated attempts to stop or decrease hair pulling. Hair pulling from the face can result in complete or partial removal of the eyebrows or eyelashes, while hair pulling from the scalp can result in varying degrees of patches and hair loss. The hair pulling and subsequent hair loss results in distress for the person and can interfere with social and occupational functioning. For some people, the symptoms of trichotillomania are manageable, but for others, the symptoms can be completely overwhelming. Symptoms of trichotillomania. The primary feature of trichotillomania is recurrent pulling of one's own hair. Hair pulling can occur in any region of the body in which hair grows. The most common sites include scalp, eyebrows, and eyelids. Less common areas include facial, pubic, and perirectal regions. Other symptoms can include the following: repeated attempts to decrease or stop hair pulling. Hair pulling causes distress or impairment in social, occupational, or other areas of functioning. An increasing feeling of tension before the hair pulling, or when trying to resist pulling. A feeling of relief after pulling. Noticeable hair loss. Playing with pulled hair or rubbing it across the face or skin. Biting, chewing, or eating pulled hair. Pulling certain kinds of hair. Hair pulling often occurs in private. Emotional states. Hair pulling may be triggered by or accompanied by a number of emotional states. It can be preceded by anxiety, boredom, stress, or tension, and can result in feelings of gratification, relief, or pleasure following the pulling. Hair pulling can involve varying degrees of awareness. Focused hair pulling. Some people engaged in focused hair pulling with the intention of experiencing tension relief from pulling. In this case, the hair pulling can include specific rituals, including pulling certain types of hair. Automatic hair pulling. Some people engage in hair pulling without fully realizing it. This can occur when they are bored, watching TV, or engaged in other mindless activities. Mixed hair pulling. Many people engage in a mix of both behavioral styles. There does appear to be a genetic component to trichotillomania. The disorder is more common among individuals with obsessive compulsive disorder and their first-degree relatives than the general population. Risk factors. Age. Onset typically occurs between the ages of 10 and 13 and can be lifelong. Other mental health disorders. People with trichotillomania often have anxiety, depression, or obsessive compulsive disorder. Stress. High stress levels may trigger trichotillomania for some individuals. Treatment of trichotillomania can be complicated, and most treatment options require time and practice. Individuals often try several strategies to cope with their urges before they find something that works. Try not to get discouraged if symptoms come and go. Habit reversal. This is often the primary treatment of trichotillomania. Individuals learn how to recognize situations where they are likely to pull hair and substitute other behaviors instead. Many people use journaling, alerts, and other strategies to increase awareness of triggers. Instead of hair pulling, a person might substitute behaviors such as clenching fists or snapping an elastic band around the wrist. Cognitive therapy. This type of therapy can help people explore distorted beliefs related to hair pulling. Self-awareness training. Individuals learn to become more aware of their hair pulling patterns by tracking when they pull and detailing emotions and other important information. Relaxation training. This helps people learn to focus on and calm their central nervous systems in response to stress triggers. Deep breathing training. Learning the proper way to engage in deep breathing helps increase relaxation and focus. Process-oriented therapy. Talk therapy can be effective in helping people explore their triggers and emotions beneath the pulling. Medication. While there are no medications specific to the treatment of trichotillomania, SSRIs and SNRIs can be used to treat some of the accompanying symptoms of anxiety. Family therapy. For children and adolescents, family therapy helps parents to learn better how to respond and manage symptoms. Group therapy. Trichotillomania can feel isolating. Groups help people connect with one another during a similar struggle and provide support for one another. Some individuals with trichotillomania learn to manage symptoms and triggers with outpatient treatment, while others require more intensive treatment. It's important to seek help as soon as possible and continue treatment on an ongoing basis.